my name's Lucy McAreavey. I'm a nuclear medicine physicist at the Royal Marsden Hospital, and I'm going to give you a brief introduction to nuclear medicine. So how did I become a nuclear medicine physicist? I did physics, chemistry and maths for A-level at Loreto Grammar School, and I didn't know exactly what I wanted to do at university or for a career, but I knew I wanted it to involve physics. And the University of Liverpool offered a degree in physics with medical applications, which seemed perfect for me as it combined my love of physics with my interest in medicine. And there's some photos here from a trip to CERN that we took during the degree. I then went on to do a PhD in nuclear physics at the University of Liverpool. My research involved looking at radiation detectors for medical devices. I was very lucky to travel to lots of different conferences all around the world during the PhD, and I did a lot of outreach work, which involved talking about nuclear physics to the general public. I've now been a physicist in nuclear medicine at the Royal Marsden for just over 18 months, and I really enjoy the job. So this isn't the only route that you can take to become a physicist in nuclear medicine. Most people would do physics at university and then go on to do something called the Scientist Training Programme, or the STP. So I suggest you have a look at that if you have an interest in medical physics. So what is nuclear medicine? It's one part of the umbrella of medical physics. So this contains nuclear medicine, X-ray physics, and radiotherapy. So nuclear medicine is the use of radioactive substances in the diagnosis and treatment of disease. So in nuclear medicine, radio tracers are injected into the bloodstream or inhaled or swallowed by the patient. So here is a photograph of a capsule containing a radioactive substance that the patient then swallows. The Royal Marsden, where I work, is a dedicated cancer hospital. So here, nuclear medicine scans are used for diagnosis and staging of cancer and for checking organs like the kidneys are functioning properly before treatments such as chemotherapy, as these can be known to cause damage. So as I said, there's two parts to nuclear medicine. The first part we'll look at is imaging, so imaging for diagnosing a disease. So for this, what we're interested in radioactive substances that emit gamma rays. So the patient will be given a tablet or an injection that contains a substance that decays via the emission of gamma rays, and these gamma rays will then leave the patient's body and be imaged by a gamma camera. So in the same way that a mobile phone would take a photograph, the gamma camera takes a photograph of the gamma rays to show the distribution in the body. And this shows to the extent to which the radioactive material is absorbed or taken up by a particular organ or tissue, and it indicates the level of function of that organ or tissue. So nuclear medicine is about functional imaging rather than anatomical imaging that you would get in X-ray or CT. There's two different types of cameras in nuclear medicine, SPECT and PET, shown in the photographs here. They work slightly differently, but they both work by detecting gamma rays emitted from a patient's body. One of the jobs as a nuclear medicine physicist is to perform daily, monthly and annual quality control, or QC tests, to ensure that these cameras are running properly. This involves drawing up radiation, making test sources, and as you can see in the photograph here, I'm drawing up a source that's radioactive liquid. I'm stood behind a lead shield and the vial of liquid is in a lead box. So my fingers are protected and my body is protected. It's important that the patient is administered with a radioactive substance that has suitable characteristics for imaging. The first thing we'll look at here is half-life, and this is the time it takes for the radioactivity to fall to half its initial value, denoted by the equation A equals A naught e to the minus lambda t. So this is important because we want to give the patient a radioactive substance that has a long enough half-life that the patient can be injected with the radioactive substance. There's then enough time to put the patient on the camera and take an image. We don't want the half-life to be too long and then the patient goes home being radioactive. So we want something in the middle, and typically the half-life of radioactive substances used in nuclear medicine is between 1 to 6 hours. It's also important to consider the energy of the gamma rays emitted from the radioactive substance given to the patient. We don't want something with such a low energy that it can't actually pass out of the patient in the first place. And we also don't want the energy to be so high that it passes out the patient and passes through the camera head without interacting, because this won't create a picture. So we want something like Goldilocks and the Three Bears, where it's not too low, not too high, but just an energy right in the middle, so it will leave the patient and interact in the detector, creating a picture. So the second part of nuclear medicine is the therapy or the treatment. And so for this, we're interested in giving the patient something that decays via alpha or beta particles. So these radio tracers will be administered to the patient and they will travel to the tumour site, continually decaying away and destroying tumour cells. And I can think of this as the opposite to radiotherapy. So radiotherapy is probably more well known as opposed to nuclear medicine treatments. But in radiotherapy, you have external radiation sources that rotate around the patient, but these can be switched on and off. Whereas in nuclear medicine, the radioactive source is inside the patient and continually decaying away. This means that then the patient is radioactive and will remain radioactive for some time afterwards. How long depends on the half-life. So in treatment, we want something with a longer half-life than we would use for imaging because we want the radioactive substance to decay away and destroy the cancer cells. It also depends on the excretion of the radiation from the patient's body. So it might mean that they have to stay in hospital for a couple of days after the treatment until their radiation levels drop to a safe level. So they might stay in a room that looks something like this. So this is one of our treatment rooms. It looks like a typical hospital room, but actually the walls are lined with lead. So this protects people on the outside from the patient on the inside. The door is also split in half like a stable door. So the top half can stay open for the patient so they're not in total isolation, but the bottom half will stay closed. And again, the door is lined with lead. So when the staff go and speak to the patient, most of their vital organs are protected from the patient in the room. So it's really important when we're dealing with the radioactive patients to follow the principles of time, distance and shielding. So we don't speak to the patients for too long, we make sure we keep our distance and we always stay behind the lead door when speaking to the patient. Now, we've spoken about imaging and how we want to use gamma rays for that, and we've spoken about therapy and treatment and how it's important to use something that it decays with alpha or betas for the therapy. But there's actually an area in nuclear medicine known as theranostics, so therapy and diagnostics. And in this case, you would administer the patient with something that decays via, say, beta and gamma. So in this case, the beta particles will destroy the tumour cells, while also the gamma rays can be emitted and imaged, so you can see the distribution of the radioactive substance in the patient's body. And the most famous example of this is the use of radioactive iodine, or iodine-131, for thyroid diseases and cancers. And so here's an image of a patient here that's been given iodine-131 that will treat their thyroid cancer, but also emits gamma rays that you can see with the gamma camera. So thank you for that. We've just given an overview of the imaging and the therapy part of nuclear medicine and how that every day we use the principles that we've learned at school and at A-level to keep patients and ourselves as staff safe. Every day working in nuclear medicine is different, which makes it really exciting. Thank you.